Who here wants to hang out with crazy people for the rest of their life? I mean, that's kind of what we want to get away from, right? Well, that's pretty much what I want to do for the rest of my life. I want to go into clinical psychology and work with people that have mental problems. I've been studying it for quite a few years now, and I'm really excited to get out into the job field, and I even have quite a few family members and friends that are already out there. And I've done some research and looked around online, and I brought a lot of stuff that I think you'll be interested in. Today we're going to talk about the potential hazards and the absolute benefits that you get from working in the field. We'll begin with the negative aspects of the job and what could happen while you're out there in the field. There are quite a few things that an aspiring psychologist like myself has to take into consideration before going out there. You can't just go head first into something like this. The biggest problem that one can develop mentally when working with people in a mental ward is that you start to diagnose your friends and family with these problems. Sean Atkinson, a mental health consultant from the Hospital of Oregon, he recently stated that it's really hard, and it always gets harder, that you always see problems in your friends. You start to see aggression and things that you didn't used to see in your best of friends. Carly Jennings, a clinical health psychologist from St. Louis, Missouri, stated that a problem that she has is she gets really attached to her patients, and she starts to see them as friends, and it starts to get harder to diagnose them. So now you've got two opposing things there. Another problem is that old friends might come into your hospital. Kids you knew in high school might start to come in with depression, or hopefully nothing worse than that. But she's even diagnosed one of her old friends with schizophrenia that developed after high school. Another thing that Mr. Atkinson pointed out is that it's really easy to get fired from some of these jobs. The insurance companies have a lot of paperwork for you to do every day, and there's all kinds of red tape and loopholes and stuff that can get you into trouble. So it's really scary trying to get into a job like that. Another thing that might happen is physical injury. A lot of times patients throw tantrums or something like that, and it's really easy to catch an elbow to the face or something like that. Tevin Jordan, a fellow psychology student here and the son of two psychologists, states that his parents want him to go into the safest field of psychology, and they want him to work with people that are neurotic, like depression or anxiety, rather than psychotic, which would be like schizophrenia or something like that. Now that we've discussed some of the potential dangers, let's move on to some of the good things that can happen while you're out there in the field. There's a lot of wonderful things that can happen. All the people that I interviewed agreed that when you're in a field of psychology, you start to gain a new perception of the world, and you really start to just gain a better understanding of how people work. Carly Jennings offered that when you see people starting to get aggressive or start arguing with you, you learn to diffuse the situation just verbally, so that's pretty nice. She also stated that coping becomes a lot easier. You learn how to cope with problems, and you get to be really grateful for the things that you do have. Tevin stated that if anything, his parents always come home with the craziest and best stories every weekend. They have something new to tell them. And Sean Atkinson stated that you learn how to read body language almost like it's a second language to you. You really become fluent in it, and you can see when people start to become aggressive or when people are interested in a certain thing or if they're bored with you. In conclusion, we've talked about the benefits and the hazards of the job in my field of choice. And although there's a lot to consider, there usually is in most career choices, and this is what I've chosen to deal with. And as long as you can move on past the negative things and keep the positive things in light, I think I'll be okay. Thank you.